May is Stroke Awareness Month, and it's really important that everyone be aware of the signs.
The average age of stroke patients is 70, according to the Mayo Clinic, but strokes can happen at any age. How you respond can make all the difference.
Your reporter in Jefferson County, Karen Morfitt, spoke to a stroke survivor who credits that quick first response with saving his life and his ability to play music.
It's often said that music can heal the soul.
And when it's time for leaving Mozambique.
And while a sort of pseudo-therapy for most, it's now a recovery tool for Mike Studeni. In February, he collapsed while getting his children ready for school.
And I just got faint. I just, went down on the ground, and then I was kind of a little disoriented.
He couldn't feel or move his right arm.
I said, oh, this is bad. It's probably time to call out to someone. And then I couldn't talk. I was like, trying to make the noises, and it barely, happened.
His son found him and alerted mom, Linda Lou, who almost immediately called 911.
I mean, I had in my mind, I'm not going to be a widow today. That's not going to happen. That's not in my cards.
Her response would set the course for his recovery.
Time is brain. We heard that so many times.
Every minute you are losing up to 2 million brain cells.
Dr. Cynthia Dickerson, a stroke neurologist at Lutheran Hospital, was the first person to interact with Mike, who was diagnosed with a non-bleeding stroke.
You can think about a heart attack being a blockage of a blood vessel in the heart. A stroke is essentially a heart attack of the brain.
Within minutes of arriving at the ER, Mike was scanned, a clot was found, he was treated with meds, and then wheeled into surgery.
Within 12 minutes of him being on the table, that clot was removed. I saw him in the ICU about 30 minutes later. He himself felt back to normal. Had he not come in sooner, had he not gotten those treatments sooner, could have been paralyzed potentially for the rest of his life.
55 years old and in good health, Mike isn't your common stroke patient. But Dickerson says it can happen at any age, and everyone should know the signs and how to react.
There's an easy acronym, B FAST, B-E-F-A-S-T. B is for balance. E is eyes, either vision loss or double vision. F is the classic facial droop, but can also be loss of sensation on one side of the face. A is arms, weakness or numbness of one side of the body and the arm. That counts for legs as well. S is for speech, not being able to get your words out or slurred speech. And T is that time. Do not wait.
While Mike says physically he feels nearly fully recovered, internally he knows there's more work and more healing to be done.
If I'm in a song and I'm singing it, that's all I'm really thinking about. I'm not thinking about all the other stresses.
How amazing, and I'm so glad he's okay.
Yeah, an incredible story. Great music, too.
Yeah, he's
awesome
super
to see what he's
talented.
doing now.
Yeah.